The past 6 years for Vea Koloa have been challenging. She's been living with a disfiguring facial tumour. Unable to afford the risky surgery, the tumour grew to be the size of Vea's head. But with support from the Tongan government and a team of Kiwi surgeons, Vea has come here for a life-changing operation. Here's John Hudson, and just a warning, there are surgical scenes some viewers may find confronting.
When Vea Koloa looks in the mirror, she sees a face that's no longer her own.
I've never seen a tumour even vaguely close to that.
And I can't wait to get rid of this.
In 3 days' time, Vea will look very different.
The most thing that I will enjoy, when I'm looking in the mirror, I got my face back.
But with change comes risk.
Well, it's really a life-threatening situation now.
Vea is from a village in Tonga called Kalofiama, on the main island of Tongatapu. She and her husband, Piper, have 9 children.
The older one is 19, and the youngest one is 4.
8 girls and 1 boy. That's Vini. He's 8. Vea has always looked like this to her younger kids.
It's been 6 years up to now. I've been with this tumor.
Did you go to the doctor?
Yeah.
Why wasn't something done earlier?
They tried to fix it, but
Just kept growing and growing,
yeah.
It's called an ambuloblastoma, which is a benign tumour. Most patients that get it would notice a little bit of swelling, maybe some tooth pain, maybe some bleeding. They would go to their dentist. It would usually get sorted out with a relatively minor procedure. I'd say you have to kind of decide where you're going to...
Kiwi plastic surgeon Zach Moavini first tried to help Vea 3 years ago, but she wasn't ready.
I think it all just sounded really scary, and she withdrew really from wanting treatment at that time.
Earlier this year, Vea's doctor contacted him again. She had agreed to the surgery.
I remember opening the attachment to the email and gasping at the size, the difference in 3 years, how much it had grown.
Have you ever seen anything quite like that?
Not even close. It's by far the largest tumour of this kind I've ever seen, particularly on the head and neck.
Api Siliva is Vea's aunt. Vea, 36, has been staying with Api and her family in Auckland since she came out of MIQ.
Yeah, I think that's about it.
Api first saw Vea's tumour on a video call.
She rang, and I said, just turn around. Because she rang and faced it away, and I said, turn around, I want to see. When I see that, my heart is so melt, you know. My heart is with her until now, and it will be there forever.
If it bothers Vea when people stare, she doesn't show it.
I'm so proud of her. Some people, they might not come and give her a hug or be close to her. How the people think of her, she doesn't even care about it. You know, she just go for it.
Back in Tonga, hiding away wasn't an option.
She feels embarrassed, but she can't help it because she still have to go out, take the kids to school, bring them home, do their shopping. She can't stay at home. All the vegetables together.
But with Vea here in Auckland, her husband has to be both mum and dad.
I think it's quite a new life for him. He said to Vea, oh my gosh, I did not even realize how you managed to look after so many kids like this. Before he sleep, he can hear too many voices before they off to sleep. Even in the morning when they wake up, you know, it's not an easy job.
Do the washing, do the cooking, do everything.
And I bet he's missing you.
So much.
Sing hallelujah.
Now it's Vea's turn to be looked after. Uppy makes sure all of her food is cooked until it's soft, because Vea can't chew anymore.
I really don't think this would have happened without Uppy.
Do you want the salt?
Uppy's just been an absolute rock for Vea. In her very gentle and stable way, has guided Vea through the various tests that she's had to go through, and just has supported her, which is fabulous.
In late July, a week before her surgery,
So how are you doing?
Vea and Uppy meet with the surgical team.
Not too nervous?
No.
Andrew Cho is an ear, nose and throat surgeon.
We make a little cup here and put a little tube to help you breathe.
While Muammar Abu Siria specialises in oral and jaw surgery.
And we do our best, obviously, to get the skin of the face back to where it was.
Zach will lead the plastics team.
We have to remove all of this. Scary, right? She's barely able to eat and drink, significantly affecting her speech. But really the main danger is going to be to her airway, because it's blocking her airway significantly.
It will take 4 surgeons working simultaneously in 2 teams to remove Vea's tumour and reconstruct her face. While the first team works to cut out the tumour, the second shapes a new mandible or lower jaw from the fibula bone in her right leg. Once complete, the bone and supporting tissue is transplanted to Vea's head. Titanium plates and screws secure this new jaw in place. Leg muscle is used to help rebuild the lining and floor of Vea's mouth, while arteries and veins are connected to establish critical blood flow.
You're removing the fibula on her right leg. Does it get replaced?
The fibula doesn't get replaced. We come with spare parts, and the fibula is one of those things. So it's a bone that we often use for different reasons, but in this case for the mandible.
Wow.
Vea
speaks to her husband and children every day.
Hello, Mommy, miss you. Hello, Dad, I miss you.
It's a time of both joy and sadness.
Don't cry.
I miss you.
I love you, baby. Pray for Mom to come back, huh?
What could go wrong here?
A lot could go wrong here. Blood loss is a potentially life-threatening issue, a stroke or a clot in the legs. We're trying to be very positive with Vea about the outcome of surgery, but we're talking about a 12-hour operation.
On the day Vea is due to be admitted to hospital,
we thank you, Lord, for keeping us strong as a family.
her kāinga gather to pray for her.
Please, Lord, let her know that she's not alone.
Yes, Lord.
That she's got all of us to catch her when she falls.
Drawing strength not only from each other,
She's truly a blessing to us, Lord, and we thank you once again for her.
but their shared faith.
I love you from the bottom of my heart. Happy. I'm alive.
We've got your room ready. Come on through.
Nurse specialist Lou Chow is part of a wider clinical team caring for Vea at Mercy Hospital.
Do not hesitate. Anything you need, you just push, okay?
Her job to prepare patients like Vea for what's ahead of them.
My role is to get them prepped for surgery, making sure that they're physically and emotionally ready. She had very, very low iron levels when she arrived. And the size of her tumour, it's really depleting a lot of her nutrients. So we really had to bring her in and give her an iron infusion and extra protein supplements to aid her in getting ready for surgery.
With just one more sleep to go, Dr. Muammar Abu Siria uses ultrasound and a felt tip pen to prep Vea's leg for surgery.
I'm just marking all the blood vessels that come from the main artery.
This will ensure the skin they take for transplant has a good blood supply. All marked up, her family at her side, Vea is finally ready.
I can't wait
To have this done.
I can't wait.
I appreciate that.
Coming up, a marathon, 12 hours of surgery.
Do you get nervous?
I'd be lying if I said I don't get nervous.
And will Vea be happy with her new face? It's still dark on the morning of Vea's surgery. But with a special gift for luck, she's in good spirits.
Do you get nervous?
I'd be lying if I said I don't get nervous. I didn't used to have any grey hair before the operation. No, I definitely get nervous.
Excited? That's good.
Is this one of the more complicated procedures that you've been involved with?
It is so large, and the potential for things to go wrong is so huge. It definitely really rates very highly on the complexity scale.
Good to see you. Good to see you. Hey? Good luck in there. Hey? Yeah, we'll see you on the other side, eh? Yeah, you'll be a new woman.
New Vea.
Still more hungry woman.
I hope so. Who's paying for all this?
Unfortunately, this surgery doesn't come cheap, so we've thankfully managed to secure some good deals for her. The virtual surgical planning technology has been donated. Mercy Hospital have agreed to give us a big discount on the surgical costs of the surgery and the hospital stay. And the surgeons have agreed to donate their time for her surgery and post-operative care.
You're doing it for free?
I couldn't think of anything better to do on a Sunday than do this for her.
Don't worry. Hmm? Say goodbye. Bye.
I can't wait to get rid of this.
Better second. Okay. Bye. Okay.
7:30 a.m. It's time.
The first thing I did when I saw the email regarding Vea's case was I thought I'm going to need some friends here.
Those friends, fellow surgeons Muammar Abu Syria and Andrew Cho, both work at the head of the table.
The tumour is limiting her ability to breathe, so the very first step of the operation is to secure the airway with a tube down the bottom of the neck, going straight into the trachea, which goes to the lungs.
Then they begin the delicate task of removing the tumour.
One of the really tricky things is to maintain her facial nerve function so her face can move. We want to preserve sensation in the mouth and the tongue.
At the foot of the table, Zach, assisted by Joseph Chen, a senior plastics registrar, exposes Vea's fibula, which will be reshaped while still in her leg. Vea's operation has been pre-planned using virtual technology. Custom-made templates will guide Zach and Joseph for every cut to ensure Vea's new lower jaw is a perfect three-dimensional fit. With Vea's surgery well underway, Uppy attends her Sunday church service.
We know it's a life-changing day for Vea.
Her brave face finally slips.
We pray for Uppy Tonga and all the family that they won't be anxious today.
Supported by a community who have also embraced Vea. Around 5 hours in, and the tumour is out. It weighs just over 2 kilos. That's more than a 2-litre bottle of milk. Now halfway through the marathon operation, we catch Zach during a short break.
How have things gone this morning, Zach?
Well, so far so good.
The tumour itself is now out.
Yeah. I'm very relieved about that. The resection team did a fantastic job that was nearly the size of the head.
Those muscles and nerves that have been stretched way out of normal shape, will they recover?
It's a little bit of an unknown as to how well they'll recover, but the capacity of the human body to heal is really incredible.
Back in theatre, Zach and Muammar begin to reconstruct Vea's face.
Now the tumour's been removed. We're missing the mandible completely on the left side of the face, and we're missing part of the floor of the mouth.
They'll use the skin from Vea's leg to recreate that floor after securing her new jaw, shaped from the fibula bone in place.
To the last two on the right-hand side.
Then the transplanted vessels are connected using a surgical microscope.
Blood vessels are very small. They're around 2 to 2.5 millimeters in size. So we use very fine threads that are probably finer than a human hair.
And finally, with Vea's facial tissues shaped and positioned correctly, it's time to close.
It's really important to get all the muscles and structures of the face back into a normal position so that she will have normal facial expression, normal smile, be able to close her eyes, because it's all been so distorted with this massive tumour.
Even on the table, the transformation is undeniable. Job done. Zach's relief is obvious. But we'll have to wait a little longer for Vea's reaction as she recovers in the high dependency unit. It's been a massive day. When we first met Vea, she was keeping a journal of her time in New Zealand. We asked her what she was most looking forward to after the surgery.
The most thing that I will enjoy, when I looking in the mirror, I got my face back.
Around 36 hours after her operation, Vea sees herself for the first time.
You ready? Okay. I know. That's amazing, isn't it? It absolutely is amazing.
Is there a chance that this tumour could grow back again?
That's a very good question. We're very hopeful that we got a complete clearance and that will be a curative procedure as far as the tumour is concerned. So let's have a look inside your mouth, please, Vea.
A week later,
That's great.
and it's Vea's last night in hospital.
The tissue from your leg looks very healthy inside.
Will Vea ever look the way that she did before she had this tumour?
I think barring missing some teeth on that side and obviously a scar, I'm quite hopeful that she will end up looking close to what she used to. The swelling on your cheek is starting to go down now. Maybe it'll take around 6 months. Yeah, but slowly it will just continue to go down. Yeah.
You look amazing. You look good.
Vea is an incredibly inspirational person. Just what she's put up with against the odds and without complaining. It is incredibly humbling.
Should we be doing more for people like Vea in Pacific countries?
At the very least, we should all be so incredibly grateful for what we have here in New Zealand. I've travelled through many of the countries in the Pacific. People live under totally different conditions with far less access to medical care.
And we can reach out to them.
And we can reach out to them, absolutely, and we can help.
"7 weeks into her recovery, most of which has been spent in lockdown, Vea now finds it easier to breathe, to eat, to speak.
Oh, wow. How are you feeling now?
I'm happy, so happy.
Yeah. Can you eat anything you like now?
I eat everything now, and I start to chew now.
So what did your children say when they saw your new face?
They said to me, oh, what a beautiful mom we got now. Especially my two little kids. They grow up with seeing me like that. And I was saying to them, I was beautiful before, and now I'm back to that beautiful. Yeah.
Vea hasn't held her kids for 4 months. And now their reunion is on hold, with travel to Tonga also disrupted by lockdown. Api knows exactly what Vea's kids will do when they can finally touch their mum's new face.
They will do the France kissing, you know, that side and that side. Not only this side, but not that side.
In the meantime, we have a message from them for Vea.
Yeah.
Oh my goodness! Wow. Oh no, I love you.
She's managed to travel to a foreign country during a global pandemic. She's managed to come through a very major operation, and hopefully she can get on with her life and never look back.
Yeah.
Oh, isn't that gorgeous? And Vea's doctors have since confirmed that all of her tumour was removed. She'd like to say a malo o pito. Thank you to all of the medical staff, her family and church community for their incredible help and support throughout her time here.